Hello there, you're now with me, Hanigui, and this is TVS News at 5. Let's dive into today's topic. A motorcycle theft syndicate led by a local responsible for over 108,000 ringgit in losses has been crippled by the police following several raids and the arrest of 7 people, including its mastermind, who also happens to be a person under the supervision of the Prevention of Crime Act 1959. It led to the recovery of motorcycles during raids at 5 locations across Kuching. The Jack Gang, whose members were believed to be actively involved in motorcycle theft, will be remanded to facilitate investigation under Section 379A of the Penal Code. Kuching District Police Chief ACP Asom Baja says that 3 motorcycles confiscated during the raid were still fully intact. From the end of 2020 until last June, 23 motorcycle theft cases in Kuching have been recorded. All those arrested own an extensive criminal record concerning drugs, house break-ins, and robberies. Now, Bintulu Development Authority, or BDA, submitted a contribution of 1 million ringgit to the Sarawak State Disaster Management Committee, STMC. Its General Manager, Muhammad Yaakob bin Kari, said the contribution intends to assist the Sarawak government in managing the COVID-19.
Di mana kerajaan negeri ataupun SDMC sedikit sebanyak memerlukan bantuan untuk perolehan vaksin dan sebagainya, ya. Kita amat terkenanglah walaupun di Bintulu tugas-tugas dan dalam memastikan peperangan kita dalam pandemik ini berjaya, ya. Secara sedikit, ya, kita menyumbang sejumlah 1 juta.
A brief presentation ceremony was held at the office of the Chief Minister Datuk Patinggi Abang Johari Tun Openg at Wisma Bapak Malaysia on Friday. Yaakob also disclosed that his party has also received advice from the Chief Minister on several matters regarding development and housing in Bintulu. The COVID-19 pandemic has had a major effect on our lives. Many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in both adults and children. In addition, public health actions such as social distancing are necessary to reduce the spread of COVID-19. However, they can make us feel isolated and lonely, which may lead to stress and anxiety. We have here on the line Dr. Ismail Drahman, a psychiatric expert, to explain further about mental issues during the pandemic. Dr. Ismail, let's start with the definition of mental health, or more precisely, what it isn't.
Yeah, thank you very much. When we are talking about mental health, I think now a lot of the public or community are having this sort of problems. According to the WHO definition for mental health, it is a state of well-being in which an individual realizes her or his abilities and can cope with normal stresses in life and can work productively and truthfully and is able to make a contribution to the community. That is the definition for mental health. Yeah, once we are having mental health problems, then definitely what I mentioned just now is going to fail, and the person might not be able to cope with life, and then sometimes they're not able to understand what are the abilities that they have. They look a lot of negative things.
Now, it has been over a year that we have been living in the new norm. Mental health issues were highlighted extensively. In your opinion, Doctor, were the rising numbers of mental health issues due to the pandemic?
Well, what we can see now through all these media reports and through all kind of media that we see online. Definitely there are some spike in mental health problems among our society. Probably some people might reach to a level where we can consider as a disorder, mental health disorder. Mental health problem is something that they are not able to adjust their life with the situation that they are facing at the moment. And as you know that since COVID came to our country in March 2020, and probably in the initial phase of it, we might not be able to realize the extent of the effect of this COVID itself, because the numbers are not that many at the time until there are a lot of mortality or morbidity among people who get affected by this COVID.
And how do the experts deal with the rising number of cases, and is it taking a toll on them?
Yeah, I think, mental health is one of the areas where a lot of stigma attached to that. So this is one of the areas where when there is no crisis or no issues, no pandemic, I think we just try to conceal whatever thing that we have. And sometimes, because these mental health issues or problem is going to go away as you adjust to the life that you have. And even though you may encounter certain kind of stress, a certain period of your life, and then after some kind of support from people around us, and then we have done something for it, and then we can recover or can get out from it, from that state. And if the same example, like as it is now, pandemic is still ongoing, and then we keep on looking at our media social report every day that we see keep on coming up. I mean, definitely we feel very worried, and then we cannot go to work, we can't mingle around with a loved one, we want to go back home, so we can't do that as freely as before. Definitely is going to cause problem to us. But as for the specialists who are handling this mental health, whoever worked in mental health before, I think they are well equipped in handling this sort of issues.
Well, Doctor, what is the advice you have for people who suffer from mental health issues and how to cope with them?
So for the public, I think at this point of time, please try to get hold of something. Like in Kuching here, in Sarawak, we have befrienders also. We have NGOs who are quite interested in helping, or even the social welfare department itself. There are so many counselors around. Or Mental Health Association of Sarawak, we have this line, or even Facebook. You just go and try to contact us, and then probably we can try to get help. Hospital or even the Ministry of Health itself, the clinic, there are services for that sort of thing. Don't be shy to show up. At least at this point of time, everybody needs some kind of help.
And there you have it from the expert himself, Dr. Ismail, on the mental health issues and concerns over the matter. Thank you so much for your time, Dr. Ismail. We will be right back after a short commercial break.
Aku Priscilla John.
Aku Studawi.
Anda nak ingat gulai dengan kami duai bak program Panggal Kitai.
Nintang hari Minggu pukul 3 lemai bak TVS Channel 122 Esro ngau My Preview. Berperandau Seraya berperindang.
Hello everyone, I'm Iki. Guess what? Rhythm of Borneo will be back for its brand new season. So be sure to check out new episodes of Rhythm of Borneo every Saturday, 3 p.m. only on TVS Channel 122 Astro as well as My TV. See you guys there!
Jam ni aku tak nak kacak. Sebab dia kacak. Betul.
Nak Elia makeover anda? Boleh. Elia dan tim akan makeover anda. Jadi jangan lupa saksikan Hias di Astro 122 dan My Preview. Tim? Elia belum lagi makeover. Jangan lupa saksikan hasil-hasil setiap Sabtu 1.45 petang hanya di TVS saluran 122 Astro and My Preview.
Hello there and welcome back. Now moving on, Malaysia has established the National Healthy Research Volunteer Register or NHRVR as a commitment to ensure the integrity and safety of clinical trials in the country. Health Director General Tan Sri Dr. Noor Hisham Abdullah said the initiative would enhance the ability and capability of Malaysia in conducting clinical trials in accordance with international standards. He added, there was a pressing need in Malaysia to detect duplication by volunteers as proactively conducted in the United Kingdom and the United States, where these countries had verifiable trial registries to monitor volunteer participation, primarily to avoid duplication by trial subjects. He explained that the NHRVR platform would adopt the concept for the clinical trials set by the National Pharmaceutical Regulatory Agency (NPRA) for inspection and accreditation program for first-in-human clinical trials. Dr. Noor Hisham said the establishment of the NHRVR under the Institute for Clinical Research (ICR) Ministry of Health was only accessible by registered and trained users, thus ensuring that data security and confidentiality were well preserved. Now, a part-time food delivery rider surpassed his own expectations and scored a 4.0 cumulative grade point average or CGPA in his Sijil Tinggi Persekolahan Malaysia STPM exams. Muhammad Izzuddin Amiruddin checked his results online while waiting for a customer's order at a restaurant. The 20-year-old said being a GrabFood rider has helped him become more mature, more confident, and strengthen his mental and physical well-being. Izzuddin struggled with the home-based teaching and learning program, as it was a new experience of not being able to interact with his teachers and friends face-to-face. There were times where he would lose hope, but regain his spirits with the support of his parents. Now wrapping up the 5 p.m. news, a pocket-sized ultrasound device is already being used in Malaysian hospitals as a diagnostic tool for the early detection of COVID-19 complications. Not only does the device give doctors more freedom of movement, as it is smartphone and tablet compatible, it also reduces the risk of catching the virus, as the diagnosis can be done on the spot. Advanced Acute Internal Medicine consultant Professor Dato Sri Dr. Paras Doshi said HTF is among the pioneers of this technology and has seen ward admissions from the emergency department drop by 62%. The device has also reduced cost and hospitalization time, allowing resources to be used for COVID-19 patients. Doctors are currently being trained to use the device. And that concludes the 5 p.m. English news on TVS. As usual, don't forget to tune in for the Nightline at 11:30 p.m. with Cheryl Shaminato. With that, I'm Henny Gui and have a pleasant day.